All right, hello and welcome. Today we're going to talk about something that if you're a parent, you've probably heard of or maybe even dreaded. Hand, foot, and mouth disease. Yeah, it sounds pretty straightforward, but what if I told you there's a whole lot more going on with this illness than just a simple rash? Let's get right into it.
Okay, so picture this. Maybe you've even lived it. Your kid's a little grumpy, maybe has a bit of a fever. And then you see them. These little spots, first in their mouth, making them not want to eat, and then popping up on the palms of their hands and the soles of their feet. Yep, that's the classic calling card of hand, foot, and mouth disease, or HFMD for short.
So what is this thing really? Well, the official definition calls it a moderately contagious viral illness. Okay, and it's known for those classic mouth sores and the rash on the hands and feet. But you know, there are a couple of words in there that really stick out to me. Moderately contagious and, especially, usually mild. That word usually, that's where things start to get really interesting. And that's exactly what we're going to dig into.
Okay, before we go any further, let's get one thing straight right out of the gate, because this confuses everyone. The name is terrible, I'll admit it, but the hand, foot, and mouth disease we are talking about today affects humans. It's caused by a human virus. It has absolutely nothing to do with the foot and mouth disease you might have heard about in the news that affects cattle and other livestock. Totally different things, not related at all. So you can't get it from a cow, and a cow can't get it from you. Good? Glad we cleared that up.
All right, so we know it's contagious. The big question is, how contagious? How does this thing actually get around? Let's trace the path.
Well, as you can probably guess, it spreads pretty easily, especially in places like daycares and schools. Basically, it's passed around through, well, all the lovely stuff that comes with having little kids. We're talking saliva, snot, fluid from those little blisters, and yeah, even through poop during diaper changes. And it doesn't stop there. The virus can hang out on toys, doorknobs, you name it. And here's the kicker, people are the most contagious during that very first week they're sick.
Okay, so now we get to the part of the story where things get a little more complicated. Because it turns out hand, foot, and mouth disease isn't caused by just one single virus. It's more like a family of culprits. Let's meet the two main players.
And this right here, this is probably the most important thing to understand. Not all cases of hand, foot, and mouth are created equal, not even close. The experience one kid has can be wildly different from another, and it all comes down to which specific virus they caught.
So let's break this down. On one side, you've got the usual suspect, coccidiovirus A16. This is the one that causes the vast majority of cases. It's what most people think of. It's mild, it's over in a week or so, no big deal. But then there's the other one, enterovirus 71, or EVA71. This one is less common for sure, but it is a much, much bigger concern. Why? Because this is the version that has the potential to be severe. We're talking serious complications involving the brain and nervous system, and yes, in very rare instances, it can even be deadly.
So this leads to a question I bet a lot of parents have asked themselves. If your kid has already had this thing once, are they in the clear? You know, one and done? Can you actually get it twice?
Well, to figure that out, let's look at some incredible research. A huge study in China tracked, get this, 12.2 million cases of hand, foot, and mouth disease. Just an unbelievable amount of data. And when they sifted through all of it, they found something really eye-opening.
They found almost 400,000 people who had gotten the disease more than once. So there's our answer, loud and clear. Yes, you can absolutely get hand, foot, and mouth again. Which, of course, leads to the next big question, how is that possible?
And here's the why, laid out perfectly. The vast majority of the time, we're talking 92% of repeat cases, it's because the person got infected with a different virus the second time. The best way to think about it is like a lock and key. When you get sick with, say, the common coccidiovirus, your immune system makes a specific key to unlock and defeat it. But that key only works on that one lock. It won't work on the lock for enterovirus 71. So even though you're immune to the first one, you're still wide open to an attack from the second.
Okay, so this brings us to what is probably the most critical part of this whole discussion. We need to talk about what happens when this disease doesn't stay mild, when it gets severe. And remember, this is almost always tied to that EVA71 virus we talked about earlier. See, when a case gets severe, we're not talking about a rash anymore. The virus can actually get into the central nervous system, and that's when things get scary. It can cause things like meningitis, that's inflammation of the lining around the brain and spinal cord. Or something called acute flaccid paralysis, which is a sudden weakness that can look a lot like polio. But the most dangerous complication of all is brainstem encephalitis, that's swelling of the brainstem,
the part of the brain that controls the absolute basics, like breathing and your heartbeat. And as you can imagine, that can become life-threatening very, very quickly.
And this chart, wow, this really puts it all into perspective. It shows the risk of either dying or having long-term neurological problems based on how severe the illness gets. So look, with just mild neurological symptoms, the risk is basically zero. But as soon as the brainstem gets involved, the risk of a bad outcome jumps to 17%. And then, if it progresses to the point where the heart and lungs start to fail, the risk just skyrockets to over 81%. It's just a stark reminder of how fast this can escalate from mild to critical.
Okay, so after hearing all of that, I know what you're thinking. What can we actually do? How do we protect ourselves and our kids? Let's talk prevention. Well, sometimes the most powerful answers are the simplest ones. Scientists studying a major outbreak came to a really clear conclusion. They said, quote, "We found a strong protective effect from better hand-washing habits." It doesn't get much more direct than that.
So just how strong is that strong protective effect? You might want to sit down for this one. The study found that good hand washing could reduce the risk of infection by more than 95%. 95%. That is just an absolutely massive impact from something so simple that we do every single day.
So it kind of leaves you with this one big thought, doesn't it? We've just talked about how complex this disease can be, with all these different viruses and these scary, severe outcomes. And yet, when we look for the best way to fight back, the science points to something incredibly basic. So you have to wonder, in the global fight against a virus like this, could it be that our most powerful weapon has literally been in our own hands this whole time?